Hey everyone, this is Patrick Stevenson again on the agent development team here at Lourie Life and Health. Wanted to make another video for you, this time showing you how to look up clients' medications using Medicare.gov. This is a tool that I really like using for all of my clients, whether I'm looking at a standalone Part D plan or a Medicare Advantage plan. It does a very good job of breaking down some different quotes, how every plan out there covers your client's unique list of medications, so you can make sure you are putting them in the right plan and saving them the most amount of money on their drugs as possible. Before we begin, I just want to put a quick disclaimer out there. This video is for agent use only. It is not intended for the general public. Also, why don't you go ahead and scroll down, smash that like button, subscribe to our channel. I don't want you missing any of the great content that we're putting out. We're really trying to put a lot of stuff out here in the beginning of 2022 to help you become better agents, help you better service your clients, and be that trusted advisor that we all want to become. So that being said, let's jump right into the video, quickly show you how to look up some medications and compare plans using Medicare's website. So the first thing you want to do is go to Medicare.gov. I've included a link in the description below to this. I would recommend that you save this as a bookmark so you can get to it quickly while you're in appointments. The next thing you want to do is go to Health and Drug Plans. Then click on Find Health and Drug Plans. You can always create an account for your client. That makes it really easy. Say next year, if you wanted to go back in and do another review for this particular client, you wouldn't have to enter all their medications in again. That's very easy. So if you want to do that, just click on Login or Create an Account. For this example, though, I'm just going to continue without logging in, and you can definitely do that as well. On this screen right here, you're going to choose whether you're looking at Medicare Advantage plans or just standalone Part D plans. For this example, I'm going to look at Medicare Advantage plans. Go ahead and type in your zip code. Right here is very important as well. If you have a client on Medicaid, you would select Medicaid here. If they get a low-income subsidy, you would select extra help from Social Security. For this example, though, I'm going to say my client does not get any sort of extra help from any of those programs. You always want to select yes here. Do you want to see drug cost? All right, so here's where you're actually going to type in the prescriptions. The first one that my client takes is going to be amlodipine. So you start typing, it auto-populates it, makes it super easy. I'm going to say they take the 2.5 milligram tablet, say they take that twice a day, and they get those filled every 90 days. My next drug, metformin. And on here, metformin is going to be metformin hydrochloride. Just so you know, this is a pretty popular medication that I'm sure you'll run into a lot out in the field. So go ahead and add that one. I'm going to say they take the 500 milligram tablet, takes it 3 times a day, gets it filled every 90 days. Let's add one more. Let's say Eliquis. This is a pretty expensive one that you run into a decent bit as well. All right, I'm going to say they take the 5 milligram tablet twice a day, get that filled every 90 days as well. All right, so there's my client's list of medications. Moving on, you need to select what pharmacy they like to go to. Let's say our client likes to go to CVS. So up here, you would just type in CVS, find pharmacies. Say they go to the one on 2 Notch, select that one. Let's also put a couple more in here, though, just to make sure we're getting our clients the best price. I have seen in certain situations it is beneficial to switch pharmacies to save some money. So I always like to put a few more than just their preferred. Let's also put Walmart. All right, so after you've done that, go ahead and select done. Now, this screen here, it's going to show you every Medicare Advantage plan available in your client's zip code. The plan that comes up at the top is going to be the plan that covers your client's medications at the lowest cost for the year. As you scroll down, that cost is going to get a little bit higher. So you can see WellCare for this client is coming in at the lowest drug cost. However, I do want to compare some plans, put them side by side, because sometimes even if the drug costs are a little bit higher, say on this Blue Cross plan right here, I would most likely look at it if it was a better fit for my client. And in that situation, you would just have to look at the doctors, look at the copays, look at the extra benefits, and determine that with your particular client, because everybody's situation is a little bit different. So let's go ahead and compare. Let's compare the WellCare no premium PPO, the Blue Cross PPO, and then let's say we'll look at this, the Aetna Premier plan here. So if we select compare for all of those, we can go down here, hit compare, and now it's going to put all of these three plans side by side. You can see all of these plans are $0 premium, and it's going to show you all the max out of pockets, all of the copay side by side. So if you did want to compare some plans to see which plan from a 1,000-foot view fit your client's needs the best, this is a great tool to use it or to do it. So let's scroll down though. Right here's what we're really looking at for this video. This is going to be your drug cost depending on which pharmacy you go to and depending on which plan your client has. So it is an estimated total drug plus premium cost. So if these plans had a premium, it would be factored in here. But since all of them are $0 premium plans, these dollar figures is what your client would have to pay out of pocket at the cash register at the pharmacy when they pick up their medications. So in this scenario, they like going to CVS. So I would tell them they can definitely stay at CVS. There's really no cost savings with any of these plans about switching. And all three plans cover their medications very similarly. It's within $10 or $20 either way. So in this situation for my client, I would look at other factors, like I said before, as far as the doctor network, the customer service, the copays, the additional benefits, just to name a few when selecting a plan. So that wouldn't really be that big a deal. Let's say after looking at all those things, we decided that the Blue Cross total value plan is going to be the right plan for your client. And your client's just curious to see what they have to pay out of pocket whenever they pick up their medications at the pharmacy. So what you're going to do, select on, let's go back. I'll show you what I did. Select plan details here. You're going to go down to drug coverage. And now this is going to give you a breakdown of what you'd have to pay for the year for each of your medications. So like I said, your client would be just fine staying at CVS. The Eliquis is going to be the only drug that they would have to pay out of pocket at the pharmacy. And over the course of the year, it's going to cost them $555. That's helpful, but also your client probably wants to know what they're going to have to pay by month. Good news is Medicare's website tells you that as well. You can scroll down, and since they get this filled every 90 days, it's only going to show you every 3 months. But you can see if they got it filled in February, it's going to be $195 at the cash register. And they get it filled in May, August, and November, it's only going to be $120 there. And this is because your client did have to fill a small deductible, and these plans do have some coverage phases. I don't want to get into the weeds there on this video just because it can get kind of confusing, but if you have any questions, you want to talk about the different coverage phases associated with a Part D plan with a Medicare Advantage plan, please give our office a call or visit our website. We got some information there. I do want to show you one more thing. So let's go back. Now, say you get to this page and you meant to look at drug plans, but you accidentally selected Medicare Advantage plans before. That's no worries at all. As you go up to the top right-hand corner, and you can see it says you view 24 available drug plans. That means in your client zip code that we entered, there's going to be 24 drug plans available for you to enroll them in. Now, instead of Medicare Advantage, these are just standalone Part D plans, so it's a little bit different. Now, you can see here, it's going to work the same as the Medicare Advantage side, and typically here, I just go with the lowest cost option. There's really no other factors to look at, just the lowest cost option, whatever plan covers your clients in the most affordable way. So you can see in this situation, the WellCare value script is going to be the lowest cost. That plan is going to be $13 a month. And between that premium cost and what your client will pay out of pocket at the pharmacy at the cash register, it's going to cost them $1,052 for the whole year. Now, if you want to see a breakdown again for this plan, you click on plan details, click on drug coverage here. You're going to scroll down. You can see amlodipine and metformin. It's not going to cost your client anything at CVS. The Eliquis for the whole year is going to cost $912.30. So it's actually a little bit more expensive than it was under that Medicare Advantage plan we looked at earlier. However, you can't be in a standard Part D plan and a Medicare Advantage plan. So the only time you'd be looking at these plans is if your client was on a Medicare supplement with this plan to cover their medications. So let's scroll down. You can also see what they're going to have to pay out of pocket at the pharmacy. February, they're going to have to meet that deductible, so it's going to be a little bit higher. After that, though, it's going to be $126 every time they pick it up. So this is a very good tool to look at different plans. You can look at Part D standalone plans. You can look at Medicare Advantage plans. Also, say you're looking at a United Healthcare plan or a Humana plan, you just want to see just those options. You can come up here to insurance carriers, select Humana, apply, and now it's going to show you all of Humana's Medicare Advantage plans and the cost it would take to cover your client's medications. So this is a very good tool, very easy to use, and I use this in basically all of my appointments where my clients take some sort of prescriptions, which is, I'd say, 95% of appointments. If you got any questions about what you've seen today, how to use Medicare.gov, you want to talk about this further, please give our office a call. That phone number is 803-256-2067. I've also put that down in the description below so you can find it there. If you're currently one of our agent partners, I just want to let you know how much we appreciate you working with us. If you're not currently one of our agent partners and want more information on about how to become one, either give us a call at the number down in the description below or visit our website. We're one of the leading brokers here in the Southeast, and we would love for you to join our team. And I'd love to talk to you more about what we have to offer here at Lourie Life and Health. Once again, my name is Patrick Stevenson. I'm on the agent development team here. It was a pleasure bringing you another educational video, and be on the lookout for more great content just like this in the future.